So let's take the concept of local and global muscles and explore it a little more deeply. What happens when some of our global muscles take on the role of stabilization and they're working too hard in an inefficient pattern to stabilize? We're going to look specifically at a few more muscles and then pull them together to see what happens when the roles get reversed and things go wrong. Let's start with the psoas. We talked about psoas last time and how it covers a lot of real estate in the body, starting all the way up here in the thoracic spine, attaching to the transverse processes, and crossing over the hip joint in front of the pubic bone, and attaching here at the lesser trochanter of the femur. So we're crossing multiple joints. We have a long line of pull, and psoas primarily has a role in movement, creating trunk flexion when both iliopsoas muscles are working together, and true hip flexion when one side is working independent of the other. Taking psoas and looking at some of the muscles closely related, we can move into the musculature of the tensor fascia latae. So we're looking here at the Tfl muscle that sits right here where the pockets may be on a pair of jeans. So it's a little bit anterior. It's a small muscle. So this small muscle has a primary role in stabilizing our pelvis. The tissue and the fibers of the TFL are interwoven to those that become the more taut IT band that runs down the lateral aspect of the leg and attaches on the other side of the knee. Together, the IT band and the TFL absorb the shock from the ground when our foot hits the ground and help to stabilize the pelvis as we absorb that shock. The other key player here is the QL, or the quadratus lumborum muscle. So the quadratus lumborum lives here in the back body. It has an attachment to the ribs, down to the pelvis, and it has a primary role in hip hiking, so unilaterally lifting the pelvis and the hip, and it also has a role in lateral side flexion. So where we can get into trouble as these muscles begin to initiate movement together is when the psoas, or a more global muscle, takes on the role in stabilization. Then we have to find a way to begin to move the body together. So to generate more hip flexion, if our psoas is tied up in a stabilizing role, we may look to use our QL and our TFL to advance the hip forward. This is an example of associated movement. I now have to tilt the pelvis, side bend, and advance the side of my body forward. I'm unable to move the body parts independent of each other because my psoas is functioning to stabilize this unit together. If I were to be able to turn off the role of psoas in stabilization, I then can free up the mobility at the hip, mobility at the pelvis, so I can advance the leg with true hip flexion. Let's take a look at one more muscle that gets caught up in this role reversal kind of situation, and that's adductor magnus. So as we look at the adductor group, it's a group of 5 muscles. They connect from the pelvis to the medial aspect of the femur. And we're going to more specifically look at adductor magnus, which has the longest line of pull and attaches most distally compared to the other 4 muscles. So adductor magnus is a global muscle. It's a powerful, big muscle, and it's designed to create and control movement, primarily adduction of the leg, moving the leg closer to the midline. It has a secondary role in hip extension. So together with glute max, it works to extend the hip posteriorly. Oftentimes, Adductor Magnus takes on the role of stabilization when our pelvic floor musculature is not doing its job as a stabilizer. So the pelvic floor musculature would be our local muscle, and the adductor magnus would be our global muscle. When our local muscles are not doing their job, the global muscle takes on the role of stabilization, which is an inefficient pattern for that muscle to take on. Where we would see this show up in our yoga practice is something like a wide-legged forward fold. And within that posture, the pelvis is locked in and unable to move around the femur bone because it is locked in from the adductor magnus, drawing it down and holding it tight as a stabilizer. If we were to free up adductor magnus and turn on our local stabilizer of our pelvic floor, adductor magnus would have the length-tension relationship to allow the pelvis to move around a fixed femur. When the movements are stuck together and we cannot move one body part separately from another, we call that associated movement. It's a very inefficient movement pattern that does not optimize our local and global musculature. When we are able to move one body part independent of another, we have dissociated movement. So bringing our awareness to a movement pattern allows us to move one body part independent of another to create efficient, effective movement. In the posterior aspect of the body, we have chains of musculature. For example, we have the hamstrings, the glute max, and the erector spinae, all global muscles. We also have the gluteus maximus, the thoracolumbar fascia, and the opposite latissimus dorsi, big global muscles. When some of these larger global muscles take on the role of stabilization, it turns off the local stabilizers. For example, if the erector spinae muscles were to take on the role of stabilizing, it would turn off the multifidus, the local stabilizers at each segment, and it would also inhibit the function of the glute max. So it would disrupt the communication of our muscular chain from the lower half of our body to the upper half of our body. If we look at the diagonal example, if we have stabilization happening in one global muscle, it can inhibit another global muscle and lessen our efficiency from one side of the body to the other side of the body. This is why our ability to dissociate our movement becomes so crucial for total body efficient, functional, and safe movement.